Hello, I'm Dr. Trainor. Today, I want to talk about something that affects millions of people who don't even know that they have it: obstructive sleep apnea. This condition is more than just loud snoring which annoys your partner or family. It's a serious medical issue where your breathing repeatedly stops during sleep. When that happens, oxygen levels drop, your blood pressure rises, and over time, your risk of stroke and memory problems like dementia goes up. The good news is sleep apnea can be treated, and doing so can help you sleep better, feel better, and keep your brain healthy. There are two main types of sleep apnea. The most common is obstructive sleep apnea, or OSA, which happens when the muscles in the back of your throat relax too much and block your airway. There's also central sleep apnea, which is less common and is caused by the brain not sending the right signals to the body to keep breathing. While both types are serious, obstructive sleep apnea is especially important to talk about today because it's common and it's strongly linked to stroke. One of the challenges with sleep apnea is that many of the people don't know that they have it because the symptoms happen while they're asleep. But there are warning signs to watch out for. If you or a partner notice loud snoring, gasping or choking during sleep, or long pauses in breathing, these could be red flags. Other signs include waking up frequently during the night, waking up with a dry mouth or headache, feeling tired during the day, or even dozing off watching TV, or even sitting at a red light. Needing to use the bathroom several times a night can also be a clue. If any of these symptoms sound familiar, talk to a VA provider today about getting screened. To help identify people at risk, your provider may use something called the Stop Bang Questionnaire. It's a simple screening tool that looks at common symptoms like snoring, tiredness, observed breathing pauses, and high blood pressure. It also takes into account your height and weight, your age, the size of your neck, and your gender. If you're curious, ask your provider to walk through it with you. It's quick, and it can determine whether you should get a sleep study. Sleep apnea increases the risk of stroke in multiple ways. It raises your blood pressure, lowers oxygen levels, damages the blood vessels in your brain, and increases inflammation. It can even trigger abnormal heart rhythms like atrial fibrillation, another major stroke risk. And if you've already had a stroke, untreated sleep apnea can make it harder to recover. That's why early diagnosis and treatment are so important. If you think you might have sleep apnea, a sleep study is the best way to know for sure. There are two main tests. One is a home sleep test where you use simple equipment to measure your breathing and oxygen levels while you sleep in your own bed. The other is an in-lab sleep study, or polysomnography, which gives more detailed information and is done in a sleep center. The most effective treatment for obstructive sleep apnea is CPAP, continuous positive airway pressure. A CPAP machine gently pushes air through a mask while you sleep, keeping your airway open. Many people worry about using a mask at night, but it helps to know that there are different styles. Not all masks cover your mouth. Some fit only over the nose, whereas others rest just below the nose, so there are options that may feel more comfortable and less bulky. CPAP machines today are also much smaller, quieter, and easier to use than they used to be. Even if CPAP doesn't work for you, there are other options. Oral devices made by a dentist can help, as can a newer surgical treatment called Inspire, which uses a small implant to stimulate nerves and keep your airway open. Some people may also benefit from medications that support weight loss and stabilize your airway. In addition to these treatments, lifestyle changes like losing weight, avoiding alcohol before bed, and keeping a regular sleep schedule can make a big difference. If you or someone you care about has signs of obstructive sleep apnea, don't ignore them. Talk to your VA healthcare provider about getting screened. And if you've already started treatment, stick with it. If something's not working, like the mask or the pressure, don't give up. Work with your provider to adjust your treatment. There are lots of ways to make it work for you. The key is to not leave sleep apnea untreated, because untreated sleep apnea can cause you to have a stroke. If you have questions, reach out to your VA team. And for more information, you can visit trusted sources like stroke.org. You served your country with strength and commitment. Now bring that commitment to your health. Know the signs of sleep apnea, take action, and follow through with your treatment plan. Thank you for watching.